Hey everybody, it's Melissa. Happy Tuesday. So, there's been a lot going on, and so I'm going to fill in the blanks of what kind of happened, like probably since my biopsy last Thursday. So, I was sore, pretty sore and uncomfortable over the weekend until probably Sunday. I was feeling better, still sore, but not where I was like walking funny, and not like so crampy and stuff, I guess. So I went to a concert on Sunday, which there's the video about that, the Hanson concert. I went with Kelly, my friend Kelly. So anyways, my whole kind of thing was to fill you in on what to expect for like a biopsy of your uterus. They're not really clear on it. They want to say like it's not that big of a deal. I've had them done, I want to say it's been at least 4 times, I think, that I've had a biopsy of my uterus and like cervix and things like that. And I've also had where they just like do a cervical, I think they call it a cervical scraping, which is basically instead of taking a chunk, they just scrape the inside and take like a little sample that way. Either way, what they tell you to do is drink a can of Coke and take some Tylenol before you go in, and that's supposed to, well, the Tylenol is supposed to, you know, just kind of reduce any kind of inflammation, things like that. But also they say that the caffeine in the Coke is supposed to help with the cramps that you get when they dilate you for these procedures. So here's my little tips, okay, because I've had this done a few times. First off, yes, I think drinking a can of Coke is a good idea, but I wouldn't do it like, I would do it like maybe an hour, more than an hour before. That way you can go to the bathroom beforehand, because otherwise if you have a full bladder, that's not comfortable. So they tell you to do it right before you come in, but then your bladder's so full and that puts pressure on everything else and it's just not comfortable. So if you're gonna drink a can of Coke, do it a couple hours ahead before your procedure. Also, instead of taking Tylenol, I ask for valium. This is very important. They're not just going to offer it to you, but if you're like, I'm having anxiety about it, and things like that, they will give you valium or something similar, and I think it's much needed. It is going to just calm your nerves down. It's very like a stressful experience to have, and 2, it makes you relax, because you do not want to be tensed up when they're down there trying to take the biopsy. You want to be relaxed, and the Valium does that. It just relaxes you a little bit where you can get through it. It's still going to hurt, okay? Sadly, there's not a lot that you can do about that other than breathe, and I'm serious. When I say breathe, you need to take like deep breaths and like try to relax yourself. So the other thing, make sure that your doctor is using some sort of numbing agent. I can't remember exactly the name of the one that my doctor uses, but all she does is she just does a little shot in my cervix. That way it's numb to a certain extent. You're still gonna feel a lot. Like I wish I could tell you that there's something, but you're awake for this. You're awake for both procedures, either a biopsy or a cervical scraping, so you're awake. So if they use some like a little bit of a numbing, you'll notice a big difference, because if you don't have it, you're gonna cry. It's gonna be so uncomfortable, because the first time that I had a biopsy done ever, I was in my early 20s and I didn't have any numbing. I didn't ask for Valium because I didn't know to. I did drink the can of Coke, so that's the only thing I had going for me, and I took the Tylenol. But afterwards, I was sore even longer, and now I can tell the difference, because it was a different doctor, and she has done most of them, but the first doctor didn't do the numbing, and so I didn't know the difference until I did the second biopsy, and I was like, okay, that was still really uncomfortable, but it was not as bad as the first one. And she mentioned she had used the numbing stuff, and that really does work, so ask for the numbing stuff. Also, I know some people, when they're in pain, they want to be vocal. Me, when I'm in pain, I'm more of like a hold my breath kind of a person. I don't know where that comes from or whatever, but you want to make sure that you keep breathing and things like that, because of course, you don't want to make the experience even more uncomfortable for yourself. So I try to like close my eyes and kind of go to a happy place. The doctor is usually talking to you during the procedure, but to me, I would rather them not really talk a ton while they're doing the actual procedure. I just want to like try to just keep my sanity and my peace. So anyways, you are going to be uncomfortable. When they dilate you, it's the best way to describe it, the way my doctor describes it, I guess, is when they dilate you, it's like if you were getting ready to have a baby, basically. They don't dilate you as much as you would be to have a baby, but that's what happens. So you get the cramps and the contractions. So that's where the caffeine, I should say, comes into play to help with that. So it's usually a fairly quick procedure. I want to say they're in and out 10-15 minutes at the most. But you will be sore for a few days, and you're gonna for sure bleed the first day. Some people bleed for like a week or so, and you're not supposed to, and they give you a sheet. Some doctors give you a sheet of the do's and don'ts after a procedure, but you're not supposed to use tampons or have sex or take baths, or anything like that for the next week after your procedure. And I think that's super important because you don't want to get an infection. Also, they use iodine to clean whatever area they're biopsying, right? So if you are allergic to iodine, I don't know what else they probably use something alcohol-based. So I would just make sure that if you do have an iodine allergy to say something, because that's what they do use. They use the iodine to clean before they do the biopsy. Trying to think if there's anything else. But you will be sore for a few days. I want to say the day of and the day after is the worst. I didn't work out for a couple days because the movement is just uncomfortable. But anyways, I just wanted to give that, inside scoop to some people that maybe have, are going in to have a biopsy or a cervical scraping, and it's scary to hear these things when you don't really know that much about it, but I promise you, you will make it through it, right? It's not like the worst thing in life, but I just want to be real with you because it is not the most comfortable thing either. But like I said, I think it's super important to, yes, drink a can of Coke. Ask for Valium before you go. You're going to have a driver because the Valium is going to make you a little loopy, but it will get you through. And make sure that you ask for the numbing stuff, okay? And make sure you tell your allergies. I mean, your doctor should know, but make sure that, if you have an iodine allergy, that they know about that. Aftercare. Usually you're going to have some like lower stomach area pain, which is like where your uterus and whatnot is. So using a heating pad helps with that also. I tend to take some ibuprofen the week after that too, because there's like some swelling and stuff. So the ibuprofen kind of helps with that and reduces some of the aches and pains and things like that. All right. So anyways, I had my biopsy done last Thursday. I finally got the results last night. Good news. Thank you, baby Jesus. My cells are normal. Everything is looking normal, and I'm so excited for this. So I have to make my next doctor appointment. And so there's going to be some upcoming videos that are probably going to be shocking to some people, but I will tell you more about what's going to happen after I go to see this this other doctor who is supposed to take the IUD out and talk to me about some things. So anyways, I just want to give you some tips on what to expect and what you can do to help yourself when you're getting a biopsy and cervical scraping and all that. Be very peaceful with yourself, okay? That's the best way to put it. Breathe. Try not to stress yourself out. It's going to be uncomfortable, but the biggest thing is to just know it doesn't last that long. And I'm so glad that my test results came back. My gosh, I was so worked up waiting for these results because if you've watched my previous videos, you know that I've had troubles like with precancerous cells, and it's very stressful. It's very stressful. So anyways, it's a happy Tuesday. I'm going to work out. And then I don't know what the rest of the day is going to bring, but I already worked this morning and everything, and I was just excited to make my video because there have been people reaching out asking me, did I find out about my test results? And I'm just like, that is so cool that so many people care. So that is awesome. anyways, have a great Tuesday, rest of your Tuesday, and I will see you guys soon.